Hello, everyone. For my journal article review, I chose the article titled Whole Body Movements During Rising to Standing from Sitting by Schneckman, Berger, Riley, Mann, and Hodge, which was published in the journal Physical Therapy. The main purpose of this article was to analyze the biomechanics of the sit to stand movement and identify how different parts of the body work together during the process of standing up from a seated position. I selected this article because I plan to become a physical therapist and I am especially interested in working with older adults. Sit to stand is one of the most common functional movements in daily life, and difficulty performing this movement is often associated with weakness, balance problems, and increased fall risk. From my experience working as a nursing assistant in a long term care setting, I see every day how challenging this movement can be for many residents. So, understanding the biomechanics behind it directly connects to my future career goals. In this study, the researchers used biomechanical measurement tools, including motion analysis systems to track body movement and force plates to measure ground reaction forces. Participants performed repeated sit to stand movements while the researchers analyzed joint angles at the hip, knee, and ankle, as well as movement of the body's center of mass. The movement was divided into four phases: the flexion momentum phase, the momentum transfer phase, and the extension phase, and the stabilization phase. These phases relate directly to biomechanics concepts we have discussed in class, including control of the center of mass, base of support, joint torque production, and coordination of forces throughout the body. The results of the study showed that standing up from a chair is not simply a matter of leg strength. Instead, it requires coordinated whole body movement. One key finding was that individuals must lean their trunk forward in order to move the center of mass over their feet before extending the hips and knees to stand. The hips and knees were responsible for producing most of the force during the extension phase, and proper timing between joints was necessary for balance and efficiency. When coordination or strength was reduced, the movement became less stable and required more effort. The authors concluded that sit to stand should be viewed as a complex, coordinated task rather than an isolated strength movement. From a physical therapy perspective, this means rehabilitation programs should not only focus on strengthening muscles, but also improving balance, movement timing, and coordination. Future research could expand on this by studying older adults or clinical populations with mobility impairments, since the participants in this study were mostly healthy individuals. In my future career as a physical therapist, I could apply these findings by using biomechanical principles to improve functional mobility. For example, adjusting chair height, modifying foot placement, or teaching proper forward trunk movement could help patients stand more safely and efficiently. This is especially important in older adults where improving sit to stand ability can directly impact independence and reduce fall risk. Based on my experience working with elderly residents, even small improvements in this movement can make a big difference in confidence and daily function. Overall, I thought this article was strong because it clearly explained the phases of movement in a way that is still used in physical therapy practice today. The use of objective biomechanical measurements made the findings reliable and clinically useful. One limitation, however, is that the study did not include many older or impaired individuals, so the results may not fully represent clinical populations. If I were to improve the study, I would include participants with mobility limitations to better understand how biomechanics change in rehabilitation settings. In conclusion, this article demonstrates how biomechanics play an important role in physical therapy by helping clinicians understand movement mechanics, and apply that knowledge to improve functional outcomes and patient independence. Thanks for listening.